Hello everyone. So am I audible? Is the screen clear so that we can start the session? So let me just check and then we will start the session. Okay. So as today is a very important topic to be discussed, that is the elbow and the radio-ulnar joint. So basically, if I talk about the elbow joint, it is a hinge variety of synovial joint. And when I was taking the session of the general anatomy, I have already told you uh, about the articulations, different types of joints, which is the fibrous joint, which is the synovial joint, which is the cartilaginous joint. So we have already talked about the type of joint in that session. But in the upper limb session, if I am going to take this elbow and radio-ulnar joint, I would like to give you the details of these joints, how they are formed, what are the relations, what are the articulating surfaces, what are the ligaments, and what is the clinical anatomy. So clinical anatomy, everything will be discussed. So if any of the students are not understanding anything and they want me to explain once again, or they have got doubt, they can ask right itself when the session is going on. Okay, so everything is fine and I'm audible. Great. So let's start with the topic. So firstly, I would like to discuss about the elbow joint. And if I talk about the elbow joint, it is exactly formed by the lower end of the humerus bone and the upper end of radius and ulna. So in this diagram, we can appreciate this is the humerus bone. And this is superiorly, we have got the lower end of humerus bone, which is having the trochlea. And this is the capitulum of the humerus bone, which is going to articulate with the ulnar bone and that of radius bone. So R for radius bone. Okay. So together, this will lead to the formation of elbow joint. So it is very important that we should be knowing all of these. And if I am talking about exactly about the elbow joint, it's an articulation which is between humerus and radius, and there is an articulation between the humerus and ulna. So it is having humero-ulnar and humero-radial articulation. Okay, we can clearly appreciate that in the image. So if I just enlarge this image, if I'm going into slight enlargement, what you can see here, we can actually see the humerus bone, lower end humerus bone, which is having the capitulum, and this is the trochlea of the humerus bone, which will articulate with the head of radius and that of the trochlear notch. So this will lead to humero-ulnar and humero-radial articulation. Okay, so basically humero-radial articulation is between the capitulum and the radial head. So this is the capitulum and this is the radial head. This is the trochlea of the humerus, the pulley-like structures which you are seeing, and this is the trochlear notch. So this all will together articulate to form the elbow joint. Okay, now so the same thing has been shown in this image. I will write the crux point. Before that, I just want you to understand the complexity of this joint. So actually, why it is slightly complex? The reason is that if I am talking about the this single elbow joint is also continuing with the superior radio-ulnar joint. So if I talk about the elbow joint, it has got communication with the superior radio-ulnar joint. So that means when I am using the word cubital articulation, it means the articulation is consist of, cubital articulation means the articulation is consist of humero-ulnar, humero-radial, and also superior or proximal radio-ulnar joint. Proximal or superior, proximal or superior radio-ulnar joint. So this is how the cubital articulation is formed. Okay, these are the components of cubital articulations. Okay, so here I just wanted to show this joint, and here you can see the image where you can see the articulating surfaces has been shown, and we can see also not only the lower end of the humerus, is articulating with the forearm bone, that is the radius and ulnar bone, and here you can also see that there is a proximal radio-ulnar joint, and this proximal radio-ulnar joint is actually forms communication with the cavity of elbow joint. So only if we take the, if we talk about the whole of the cubital articulation, so in that case, we also consider superior radio-ulnar joint as one of this component. Okay, so basically the complexity of elbow joint is increased by its continuity of this joint with that of superior radio-ulnar joint. Okay, so and again in this diagram, I just want you to know that which type of joint is the elbow joint. So elbow joint is hinge variety of synovial joint. So when I am using the word hinge variety of synovial joint, it means the movement is in one plane. So around the elbow joint, we have got flexion and extension movement taking place. So we will talk about the articulating surface. Before that, I just want that you should see this image and understand that lower end of the humerus articulates with the upper end of the radius and ulna to form the joint. So basically, let's write, actually there is two articulations. So I just want you to mention about the first articulation is humero-ulnar articulation. Okay, humero-ulnar articulation. Got it? Yes. So in humero-ulnar articulation, we have got the articulation which is taking place between trochlea of humerus bone, which is a pulley-like structure, trochlea of the humerus bone, which is articulating with the trochlear notch of ulna, which articulates plus sign with the trochlear notch of ulna. Okay. Okay, so basically, if I talk about the upper limb topic, shoulder joint is most important topic which comes as a long question, but also short note can come on elbow joint, and also in the practical viva examination, they can ask about the elbow and the radio-ulnar joint. So that is why we should also focus on these topics. Okay, now the second articulation is between, that is humero-radial articulation. Okay, so if I talk about humero-radial articulation, it takes place between capitulum of the humerus bone and the head of radius. Head of radius. So yes, this is all the articulating aspects. So what I have shown you is all the articulating aspects of the of how the elbow joint is formed. Okay, any students who is not understanding anything, let me just check, they can ask me the doubts. Okay, okay everyone. Yes, so now moving further, I want you to show two images to better make you understand the articulating surfaces. Okay, so that you can understand the articulating surfaces. So you can see here you can see this capitulum structures which you are seeing. So let me slightly enlarge this image. Is it okay? Yeah. Now is it clear? Yeah. So you can see the rounded structure, the rounded surface. This is the capitulum. Lower end of the humerus is containing capitulum. Okay. And the other part which you are seeing pulley-like structure, this is the trochlea. This part is the trochlea. So we can also use another color for it. So let me use this color for the trochlea, darker shade. So this is the trochlea. So we have got the trochlea and we have got the, so this pulley-like structure which you are seeing is the trochlea, and this rounded structure is the capitulum part. These are the upper articular surfaces, okay, which is formed by the lower end of the humerus. Now lower articular surfaces is formed by upper surface of head of humerus. So this is the upper surface of head of humerus, okay. This part is the head of humerus on this upper surface. This upper surface is the head of humerus, upper aspect of the head of humerus, and also we will have the trochlear notch. So you can see here, this is the trochlear notch. So we have got articulation here. This will lead to the formation. So here, this is the articulating surface. So I have discussed, this are the upper articular surface and these are the lower articular surface. This is another image where AP, where you can see the antero-posterior X-ray of the elbow joint. We can appreciate the olecranon process of ulna. We can see the trochlea. We can see the capitulum and trochlea here, which is the parts of the We can see here trochlea and capitulum, which are the part of the humerus, and we can see here the head of humerus articulating with the capitulum, and the trochlea and the trochlear notch articulating. Okay, so elbow joint. So if I talk about capitulum, it is a rounded hemispherical eminences, and it is having a smooth aspect on its anterior surface. Just medial to it, just medial to capitulum, we have got trochlea, and the trochlear part of the humerus is in the form of pulley. What you can see, the medial flange of the trochlea is projected to the lower level as that of lateral edge. So let me show you that. So see here, there is another diagram in which you can see the trochlea, and here you can see this is the radius bone, this is the ulnar bone. This structure, which is like a rounded hemispherical structure, is the capitulum, and here you can see this part is the trochlea, and in this pulley like shape, what is it shape? The shape of trochlea is pulley like, and you can see the medial flange. This is the medial flange. So medial flange of trochlea projects to a lower level than lateral flange. Also, you can see the head of humerus, and we can see the trochlear notch of ulna. So, we are very clear with the articulating surfaces, the upper and the lower articulating surfaces of the elbow joint, and how the elbow joint is formed, which is a synovial joint of hinge variety. Which variety? Of hinge variety. Done. Now, so articulating surface we have already talked, and we are knowing about this. We can also make a diagram. So basically, if it comes for your theory paper, you can make a diagram showing the articular surfaces. So I have explained you by taking so many of images, and I think you are understanding it. But when it comes to your theory paper, you can draw the articulating surface, or it is okay if we draw the articulating, if we draw the structures, and we also will show the attachment of important ligaments. Okay, so let's draw also the articulating surfaces of the elbow joint. So for that, I would like to make lower end of humerus. This pulley shaped structure is the trochlear notch. Okay, this is the trochlea. So then, and it is articulating with the head of radius, and here we will draw also the upper end of ulna. Okay, so we can use gray color for the bony structures. So just using gray color. So always in anatomy, follow the color rule, which I have already explained in the previous session. Okay, so we will use gray color for the bony structures. Now let me label it. Humerus bone. Is it okay? This is the humerus bone. Then we are seeing this is the radius bone. This is the ulnar bone. The articulating parts. So groups are there. Okay. So, and let's talk about the articulating structure. So articulating part is the capitulum. Capitulum. Okay, capitulum. Okay, this is the trochlea. Okay, And we can also exactly show you superior radio-ulnar articulation. So here also there is actually this articulation, let me use a dotted red line so that you can understand. This articulation which I am showing with the dotted red line is the articulation of in between the capitulum and head of radius. So what is this? This is the head of radius. This is head of radius. Okay, so this dotted line and this structure which you are seeing is the depressed structure is the trochlear notch of ulna. So basically I have shown a dotted line that is showing you the upper and the lower articulating surfaces, which is articulating in between, which is an articulation between the capitulum, head of radius, the trochlea and the trochlear notch. Here I also want you to draw another dotted line showing an articulation which is taking place between the proximal radio-ulnar joint. Okay. So these are the important articulating surfaces, and as I have drawn a diagram where I also want to mark. So this is an elbow joint. So this diagram is showing you the articulating surface. Now I will also just draw the lateral and medial ligament. Okay, so this are the lateral and medial ligaments, okay, which is supporting the elbow joint on either side. So we will have this as the ulnar collateral ligament. And here we are seeing on the other side, we have got the radial collateral ligament. Okay. Okay, and also here you can draw another ligament which is connecting the proximal part of radius and ulna called as quadrate ligament. So if I am talking about the whole joint, so which I am talking about the cubital articulation, so that is all including the lower end of the humerus, the upper end of the radius and ulna, and also it is including the proximal radio-ulnar articulation. So only I have shown you the proximal radio, so that is superior or proximal radio-ulnar articulation. So please mention this. This is proximal radio-ulnar articulation. Okay, got it? Done. So we have done with this. So we have drawn a neat label diagram showing the articulating, the upper and the lower articulating part, and the proximal radio-ulnar articulation, which is also taken as the component of cubital articulation. So elbow joint is further increasing its continuity with the superior radio-ulnar articulation. So done with this. Now let's talk about the important ligaments. So basically, let's talk about the ligaments of elbow joint. So I would like to explain one by one. Firstly, I would like to explain the capsular ligament. Then I will explain the medial and lateral ligaments, which is forming an important support for the elbow joints. Let me just check with the students. Are they understanding? Any doubt, you can ask me. My dear students, if you are not understanding any doubt, please let me know. Okay, so good. So let's now focus on to the other ligaments. So I would like to start with the capsular ligament and joint capsule. So if I'm talking about so all the synovial joint is having fibrous capsule, and inside it is lined by synovial membrane. So this is the characteristic feature of a synovial joint. So fibrous sac is enclosing the joint cavity of elbow joint, and inner surface of the fibrous capsule of elbow joint is lined by synovial membrane. Other than that, it's important that we should be knowing about the attachment of this fibrous capsule of elbow joint. This is commonly asked in examination also in the viva. So I would like to explain what is its attachment on the upper part and what is the attachment of fibrous capsule in the lower part. So firstly, I would like to explain, and then I will draw a neat label diagram to make you understand its attachment, which you have to make in the examination also. So let's talk about attachment. So if I talk about upper attachment of fibrous capsule, it is just attached distal to medial epicondyle. So above. Firstly, I want you to know the attachment above. Okay, so above, fibrous capsule on the upper aspect is attached just distal to medial epicondyle. Okay, just medial to epicondyle के distally attach होता है. Are you able to appreciate this, or should I write in the second line? Distal to medial epicondyle. Now is it clear? Okay. Okay, so and upper, not only this, it is also attached to the upper margin of the radius coronoid and olecranon fossa. So if you will see the lower end of humerus, there is fossas which is called as coronoid, olecranon, and that of radial fossa. So it is also seen, I think we can see an image where we can appreciate these fossas. That is important for you to understand. Okay. So there is a diagram. Okay, so you can see here where I have written a hinge variety of synovial joint is the elbow joint, where you can see the coronoid fossa. Okay, you can see the coronoid fossa, you can see the radial fossa. Radial fossa is on the lateral aspect above the capitulum. Above the trochlea, we have about coronoid fossa. And when you see the posterior view, you can also appreciate the olecranon fossa. So that will be seen in the posterior view. Okay, so here you can see olecranon process of ulna is articulating with the olecranon fossa of the lower end of the humerus bone. So that is important. Now let's move further. Okay. Done. So upper attachment, if I'm talking about upper attachment, so we'll make a diagram for it also, don't worry. So upper attachment की बात करें, अगर हम upper attachment की बात करते हैं, तो it is just attached distal to medial epicondyle and it is attached to the upper margin of the radial, the coronoid and olecranon fossa. Medial epicondyle and upper margin of radial, coronoid and olecranon fossa, and to the lateral epicondyle and distally and to the lateral epicondyle of humerus. So that is on the distal aspect. So what do you mean by this distal aspect? Actually, I want you to know that basically why I am telling this, because I want you to know that when I am talking about medial and lateral epicondyle, so it is important for you to know that epicondyles, which is present in the lower end of the humerus bone, are exactly the bumps, actual bumps on the articular surfaces, and they are actually prominent bony eminences which is seen. And if I talk about the these epicondyles, they are outside the fibrous capsule, so they are extracapsular. Okay, so if I explain the attachment of the fibrous capsule, they are just distally, means they are just attached marginally to the both epicondyles. But these two epicondyles, actually coronoid, olecranon, radial fossas, are lying inside the fibrous capsule attachment, but they are epicondyles are actually extracapsular. So it is important, medial epicondyle, lateral epicondyle are actually, they are extracapsular. So they are extracapsular structures of elbow joint. Okay, they are extracapsular. That is very, very important for you to understand. Let me just check with the students. Are they able to understand? Okay. Now, thereafter, let's move further. So we now we will talk about the lower attachment. So this was about the upper attachment of fibrous capsule. Now we will talk about the lower attachment. So please write down lower attachment. Now talking about lower attachment of fibrous capsule. Lower attachment of fibrous capsule. Okay. So lower attachment of the fibrous capsule, if I'm talking about, it is attached to the margins of coronoid process, and it is also attached to the upper aspect of annular ligament. So that is very important. So it is attached to the margins of coronoid process. To be more specific, which margin? The medial and anterior margin. So it is attached to the anterior and medial margin of coronoid process of ulna. Coronoid process of ulna and upper margin of annular ligament, and to the upper margin of annular ligament. Okay, upper margin of annular ligament, and also it is attached to, not only this, it also is attached to the margins of olecranon process. So upper attachment of annular ligament and upper and medium, so medial margin of olecranon process also attached to the medial margin of olecranon process. So actually this olecranon process, the coronoid process, these are the parts of ulna. So in other words, what is important for you to note in this point, that if I talk about fibrous capsule, it is not attached to the radius bone. It is attached to the upper margin of annular ligament of radius bone, but it is not attached to that of the radius bone. So till now, what we have seen about the upper and the lower attachment of the fibrous capsule, and we are quite aware that the fibrous capsule attachment is actually attached on the upper aspect. It is attached to the upper margin of the radial, coronoid and olecranon fossa, and to the distally to the lateral and medial epicondyle. Exactly, if I talk about lateral and medial epicondyle, it is extracapsular, outside the fibrous capsule of elbow joint. Lower attachment is to the medial margin of coronoid process, also to the upper aspect of annular ligament and medial margin of olecranon process. Okay, so here we can note down that it is not, the capsular ligament is not attached to radius bone. Clear? So till now everything is clear. Now let's talk about this further and just make a diagram. So just make a diagram for it. So I would like to make a diagram for it. So let me slightly enlarge this image so that you can have a better idea. Okay, so now we can make a diagram showing the fibrous capsule attachment. So I would like to make a diagram showing anterior, posterior and anterosuperior aspect for the capsular attachment of elbow joint. So I should make a diagram showing, firstly, I would like to make a diagram showing anterior aspect. So we will, anterior aspect when I am talking, so actually if I talk about the olecranon fossa, which will be seen only when I can show you the posterior view of the humerus bone. So for that, to explain you the upper attachment, I have to show both anterior and the posterior view of the humerus bone. So in this diagram, I'm going to make it two diagrams. Okay, so I'm just making two diagrams. Okay, diagram A and diagram B. So, okay, when I am making diagram A, it is showing the attachment of fibrous capsule from anterior aspect, and diagram B will show the fibrous capsule attachment from the posterior aspect. Okay, so for that, as we know, upper attachment, if I am talking about the upper, so firstly I would like to show you the proximal. Firstly, I would like to show you the proximal attachment of fibrous capsule. What? Proximal attachment of fibrous capsule. Okay, so let's see the proximal attachment. So for proximal attachment, let's draw lower end of the humerus bone. Is it okay? Done? What is this rounded? Capitulum, trochlea, slightly better. Okay, so then this is capitulum. So again, let's Mark it with gray color. This is the lower end of humerus bone. Okay. So here this is the capitulum. This is the trochlea. Just above this we will have the two grooves. Okay, we can have the two grooves. What are this? So the depressed area or the fossa which is lying above capitulum is called radial fossa. What is it called as? It is called as radial fossa. And the other one which is actually showing the fossa above the trochlea is called as coronoid fossa. Okay, done. And the fibrous capsule. So for fibrous capsule, I will use another green color, and this is the fibrous capsule which is enclosing all these two fossas. So what is it? This is the capsular ligament which I have shown you. So the green color structure which I have shown you is the capsular ligament. Done. Now so this is the image showing anterior view. This is the image of anterior aspect. Now drawing another image for the posterior aspect to show you the olecranon fossa also. Okay, so let's draw one more image. Here I will show you the lower end of humerus from the posterior view. Okay, so this is actually, this rounded part is the posterior view for capitulum. This part which you are seeing is the trochlea. And here I want you to show this grooved part which you are seeing is the olecranon fossa. This is olecranon fossa. Okay. And I also want you to show the medial and lateral epicondyle. So this side will be the LE and this is the ME. What is this? These are lateral and medial epicondyle. So here ME means lateral and medial epicondyle of humerus. Medial epicondyle of humerus. Medial epicondyle of humerus is the common origin of flexor group of muscle. Lateral epicondyle of humerus is the common origin for extensor group of muscles of the forearm. And what about our fibrous capsule? So the fibrous capsule is enclosing these two. Okay, so this is enclosing the olecranon fossa. So let's label it also. This is showing you the attachment of fibrous capsule. So see here from the posterior. So this exactly, I just want to highlight that this exactly is showing you the attachment of fibrous capsule from anterior and posterior aspect. Okay. Now we can see the upper proximal, that is upper attachment of both the, let's show it in gray color, the proximal attachment of fibrous capsule which we are seeing from the anterior and posterior aspect, the proximal attachment. And I would like to draw another diagram which will show you the distal attachment of fibrous capsule. So done. Let's make another diagram. Okay. So in another diagram, I would like to draw both the radius and ulnar bone. And actually overall the radius bone is not lying inside the fibrous capsule, but its annular ligament upper part attachment is there. So let's see here. So I would like to draw one side the radius bone. Then I would like to draw the ulnar bone. Yes. Okay, just an outline. Okay, so basically, okay, so this is the elevated part which I am showing you is the olecranon process of ulna bone. Okay, this is ulna bone and this is the radius bone. I would also like to show here the annular ligaments. What is it? This will be also in the annular ligaments. This is annular ligament. Got it? This is head of radius. Okay, and we will also show you the trochlea. This part is the trochlear notch of ulna. Then highlighting the fibrous capsule attachment, so that it will be like this. Okay, this line which I have highlighted is the attachment of fibrous capsule. Fibrous capsule of elbow joint. Distal aspect. This is distal aspect. This is distal aspect. Okay, so upper aspect of annular margin is giving attachment to fibrous capsule and the margins of. So basically, and we will also see the margins of the medial margin of the coronoid process and the margins of annular ligament, the margins of the olecranon process and that of coronoid process. So basically, we can see it will be having attachment to the margins of the olecranon process, to the part of the trochlear notch, that is coronoid process. So it is mainly, you can see it is attaching to the ulna bone in the distal aspect and to the upper margin of annular ligament, not the head of the radius entire. It is that attachment that is around the annular ligament. Okay, so done with this. Now, so basically, if I talk about synovial membrane, so synovial membrane will be lining the inner aspect of the joint capsule. And it will also, if I talk about the inner surface of joint capsule and the non-articular bony parts which lies inside the capsule will be lined by synovial membrane. Synovial membrane, if I talk about the synovial membrane of elbow joint, it is continuous inferiorly with the synovial membrane of superior radio-ulnar joint. This is very important point. So we will make a sagittal section also. Here I want everybody to note a very important point. The synovial membrane of elbow joint is continuous inferiorly with the synovial membrane of superior radio-ulnar joint, Got it? This is an important point. Actually, I would also like to draw a sagittal section of the elbow joint. So let's draw a sagittal section. Done with this. Now I want you to draw elbow sagittal section. Okay. So let's draw elbow sagittal section in which I can show you the upper end of humerus and lower end of the ulna in the sagittal section. It will shown like this. Okay. Articular cartilages we can draw, no? This is the articular cartilage which I have drawn. Okay. We can use blue color showing the articular cartilages. This is the articular cartilage which I have drawn. These are the articular cartilages. Okay, my dear students. Okay. Other than that, I would also like to draw the synovial membrane on the inner aspect of the joint capsule. So we have to draw the joint capsules also. I already talked about the attachment of the joint capsule. Okay. This green color is the fibrous capsule of the elbow joint. Okay. And also I would like to show you the synovial membrane on inner aspect. Okay. Here, so, okay. Also, if this is the posterior aspect, so can I show you the muscle fibers also here? So this is the posterior view, so I can show you the triceps muscle inserting into the olecranon process. And here anterior aspect brachialis muscle, which goes into the ulnar tuberosity part. Okay. Now, done with this. So here we can see also close to it, we can see here coronoid process of the ulnar bone. This muscle is the, and actually in between the triceps muscle and posterior aspect, we can see a small bursa, that is olecranon bursa. So let's draw a small bursa here. That is olecranon that is the subtendinous olecranon process, and this will be the subcutaneous olecranon process, olecranon bursa, sorry. So let's highlight it. Okay. So this is subtendinous olecranon bursa, and the one just lying in between the triceps and that of the skin of the elbow area posterior aspect, this will become subcutaneous olecranon bursa. Okay, this muscle is triceps on the posterior aspect. Anterior aspect, we have got the biceps, no, brachialis muscle. Brachialis muscle, we have got the joint capsule. This is the green color joint capsule. We have got the synovial membrane. This structure is the synovial membrane. And we can see the, also we can appreciate the articular cartilages. So what are these? These are the articular cartilages. So blue color structure is the articular cartilages. So this is an image of the sagittal section of the elbow joint. Okay, so let's So we have finished about the type. We have seen the articular parts. We are also discussed about the fibrous capsule attachment. We have also discussed about the synovial membrane lining inside the fibrous capsule and how the continuity of the synovial membrane of elbow joint is also continuous inferiorly with the synovial membrane of the proximal radio-ulnar joint. Now, I would like to also explain two more ligaments that is lying on the medial and lateral side. So we have got ulnar collateral ligament on the medial side and we have got radial collateral ligament on the lateral side. So let's talk about the ligaments of elbow joint further. So yes, my dear students, till now everything is okay. Any doubt, please let me know. If any doubt is there and anyone is not understanding anything, please let me know. Okay? Yeah. So now we will draw another one that is called as the medial ligament, which is also called as. So actually, I want you to explain what is medial collateral ligament and what is ulnar. What is the ulnar and radial collateral ligament? So actually, when the second ligament is the medial ligament, which is also called as the ulnar collateral ligament. Okay, dear. These are the important ligaments of elbow joint. Actually, this has having three parts. Actually, this is triangular in shape and it is attached to the medial epicondyle of the humerus bone, and the base of this ligament is attached to coronoid process and olecranon process of ulnar bone. So basically, it is also important to know that how many parts this ligament is having, and it is also important to draw a diagram showing the ligament. So first thing is that it is a triangular ligament. It's a triangular in shape ligament. The apex of this triangular shaped medial ulnar collateral ligament of elbow, the apex is attached to medial epicondyle of the humerus bone. And what about the base? Base passing lower down to the ulnar bone. So base of this ulnar collateral ligament is attached to coronoid process and the olecranon process of ulnar. So its base is attached to coronoid and olecranon process of ulnar bone. Done? And it is important to know the parts. So we have to know how many parts this medial ligament or ulnar collateral ligament is having. So this is having three parts. Okay. So if I talk about the medial ulnar collateral ligament, it is having a strong anterior part, it is having a posterior part, and it is having an inferior part. The strongest and the toughest or stiffest is the anterior part of the medial ulnar collateral ligament, which is extending, which is actually extends from the front of the medial epicondyle to the tubercle, which is lying on the coronoid process. Okay, medial margin of coronoid process. So this is about, and if I talk about the posterior part attaches from the back of medial epicondyle to the medial margin of the olecranon process, and the third part is the inferior part. Actually, it is an oblique band which is connecting these two parts. Okay, which is connecting the anterior and the posterior band of medial ligament or ulnar collateral ligament is called as the inferior part of the this ligament. So let's write it. Okay. So write down first. So we are talking about parts of ulnar collateral ligament. We are talking about parts of ulnar collateral ligament. Parts of ulnar collateral ligament. Okay, parts of ulnar collateral ligament. Okay, now the first part is the anterior part. The first part of the ulnar collateral ligament is the anterior part. And when I'm talking about the anterior part, it is the strongest part of the medial collateral or ulnar collateral ligament. It is having its superior attachment to the medial epicondyle of humerus. To be more important, anterior part extends from the front of medial epicondyle. So anterior part is the strongest part, extending from anterior aspect of medial epicondyle of humerus bone, anterior aspect of medial epicondyle, ME for medial epicondyle of humerus bone, to a tubercle of the coronoid process of ulnar bone, to the tubercle. To be more specific, this tubercle is lying on the medial margin of coronoid process of ulnar bone. Okay, so this is which part, my dear student? This is the first part, that is the anterior part. When we talk about the posterior part, the second part is the posterior part. The posterior part of the ulnar collateral ligament extends from the back of medial epicondyle to the medial margin of coronoid of the olecranon process. Sorry. So it is extending from back of medial epicondyle, obviously medial epicondyle of humerus bone. So medial epicondyle of humerus bone to the medial margin of olecranon process. Is it okay, my dear? Now, what about the third part? The third part is called as, the third part of the ulnar collateral ligament is called as the inferior part. So let's write about the inferior part. So done till here. Now I just want you to write the third part, which is called as the inferior part. Inferior part. Inferior part of ulnar collateral ligament is an oblique band extending between which is actually forming a connecting link between the anterior and the posterior part. So it is extending between the olecranon and coronoid process. Olecranon and coronoid process of ulna. Done? So this explains about the attachment of the medial or the ulnar collateral ligament. Now I would like to make a diagram so that you can understand the medial ulnar collateral ligament. Then I will again explain the lateral one, and then we will draw the part of the diagram showing the lateral collateral ligament of elbow joint. So let's, or otherwise we can just explain you about the lateral one, and then we can draw the diagram together. So which is the next one? The other ligament is the radial, which is also called as the radial, which is also called as lateral collateral ligament. Lateral collateral ligament of elbow joint. Done? Okay. Okay, now it extends from, if I talk about the lateral ligament, lateral radial collateral ligament, it extends from the lateral epicondyle of humerus, which is a common extensor origin, to that of the annular ligament with which it blends. Actually, for the fibrous capsule attachment also, I have told you that lower aspect attachment is on the annular ligament, superior aspect. Same way, the radial collateral ligament is attaching from or extending from lateral epicondyle of the humerus bone to that of annular ligament superior. So let's write it. A lateral ligament, it extends from lateral epicondyle of humerus, lateral epicondyle of humerus, to the annular ligament with which it blends, with which it merges or blends. Okay. Okay, so we have done with this. we have explained. So these are the important ligaments of elbow joint. We have completed that. I just want you to draw a schematic diagram so that you can draw the same diagram in your examination paper when it comes in your theory university papers or your incentive exam. So please draw this diagram. And then after we will talk about the relations of elbow joint. So let's me just explain firstly a diagram. So we will do two diagrams. One will be showing the medial ligament and the other is showing you the lateral ligament. Okay, lateral ligament, that is important. Okay, that is very, very important to understand. So let's make a diagram. So make a diagram A. We will do two diagram, one A, another B. So actually lateral view should be there so that you can understand. So this is showing you the humerus lower end. Obviously somewhat circular will be the lower end, no? Rounded. Yeah. Then this will be articulating with the ulna. Okay. This will be olecranon process. This irregular part which I have made, let me use brown color now. Let me use gray color. This part which I am showing is the coronoid process. Okay, rough part. And this part is the humerus lower end, which will have medial epicondyle. So here actually I am showing you from the medial epicondyle only. We will have, this is the medial epicondyle part. We will have, let me use green color for this. We will have from the medial epicondyle front, we are going, the fibrous anterior band is going towards the coronoid process anteriorly. Then we will have the posterior part, which will be attaching from the posterior aspect like this. Okay, let me use green color. Okay, so these are the parts. So what is this? This part is the posterior band. This will be the anterior band. Okay, this will be the anterior band. So posterior band is going towards the olecranon process. Anterior band is going towards the coronoid process, and the gap between the olecranon and coronoid is filled with the inferior oblique band. With the inferior oblique band. Done. So this is the diagram A, which is showing you the ulnar collateral ligament. What is it showing? This diagram A is showing you the ulnar collateral ligament. Ulnar collateral ligament, obviously of elbow. Ulnar collateral ligament of elbow joint, which we have drawn. So basically, if I talk about this ligament, one more important correlation I want you to tell that here on the ulnar collateral ligament, we have also got the relation of the ulnar nerve, which is right behind medial epicondyle. So behind medial epicondyle, we have got the ulnar nerve, which is related to this ulnar collateral ligament. So please label it. This structure which you are seeing is the ulnar nerve. Done? Done? Okay, now coming to the other radial collateral ligament, very simple lateral, it is attached to the lateral epicondyle of the humerus bone and to the upper aspect of annular ligament. So then we will see the other image, that is B. So we can draw one more image, that is B. So done with this. Now we can draw another image, that is B image. That will be of radial collateral ligament. So this is the image of radial collateral ligament of elbow joint. Okay, so again, we have to show the lower end of the humerus, lateral view. This will be the lateral epicondyle of humerus. What was this? This was ME. This was ME. What do you mean by ME? ME means medial epicondyle of humerus. And what is this? Lateral epicondyle of humerus. I always tell the students, for anatomy, have your notes, pencils, color pencils, everything ready with you, because you have to draw diagram along with me, because anatomy is nothing without the diagram making. So it's the lateral epicondyle of humerus. This will be the radius bone. Whole of it is covered by ligaments. Okay. Okay. So this is radial collateral ligament. This will be merging with the annular collateral ligament, which is encircling the head of radius, Which bone is this? This is the radius bone. You can obviously use gray color for the bony prominences. That. So we have completed the details of all the ligament here. We have just completed the details of all the ligament. Now I want, yes, good evening Mudit, good evening Mudit. So now I want everybody to understand about the relation. So we have drawn this. Now I want you to know about the relations of elbow joint. Okay. Okay, now coming to the relation. So firstly, I would like to mention the relations and then we can draw a diagram about the relations of elbow joint. Okay, we can mention it and then we can draw a diagram. So basically the important structures, of the elbow joint anteriorly will be the structures which is also seen in the cubital fossa. We have already covered the cubital fossa. So let's write anterior relation. Okay, so on anterior aspect, we will have the brachialis muscle. And I think you are knowing brachialis muscle is forming the floor of upper part of cubital fossa. We will have the medial most structure in the cubital fossa, the medial nerve. Then we will have the brachial artery. And we will have tendon of biceps. This is anterior relation. What about the structures? So these are the structures: tendon of biceps brachii muscle. Actually, these are the tendons which is also seen in the cubital fossa region, which we have talked. Actually, uh, exactly, it is important that you have to draw a suitable diagram. So basically, if I talk about the structure, that is medial nerve, the brachial artery, the tendon of biceps brachii. These are the structures which is separated from the joint capsule by the brachialis muscle. Now coming to the posterior relation. Posterior to the elbow joint, we will have tendon of triceps and anconeus muscle, and also we will have the posteriorly we will have the ulnar nerve, and we will have flexor carpi ulnaris. So we will have tendon of triceps. Obviously, it is attached onto the olecranon process. We will have anconeus muscle, which gives support to the triceps muscle. We will have the tendon of we will have the muscle flexor carpi ulnaris muscle. And we will also have the ulnar nerve. To be more specific, it lies posteromedially. And we will have the common flexor origin, which is anteromedially. We will have common flexor origin anteromedially. Okay. So we have discussed about the anterior and posterior relation. So we are now knowing what structure lies anteriorly and what structures lie on the posterior aspect of elbow joint. To be more specific, let's also know about the relations on the medial and lateral aspect. So let's mark it. The third point will be the relations medially. What are the structures related to the medial aspect of elbow joint? So the structures basically actually medially was the structures which is flexor carpi ulnaris. So basically this structure is more, if I talk about ulnar nerve, here itself you can mention, no need. So here the ulnar nerve is posteromedially. Okay. So basically the tendon of triceps and anconeus is more towards the posterior aspect. And exactly if I talk about medially, it will be the flexor carpi ulnaris mainly, and ulnar nerve and the common flexor. They are also medially, but they are posteromedially and anteromedially. Okay, so that is important. Okay, so that is tendon of triceps and anconeus will be exactly posteriorly, and if I talk about medial aspect, then we will have posteromedially flexor carpi ulnaris and anteromedially the common flexor origin. Okay, the muscles of the common flexor origin of the forearm. Okay, and flexor carpi ulnaris, which is on the medial aspect. To be more precise, okay, okay. Now, laterally, if I talk about, is the common extensor origin. And to be more specific, again, the word should be corrected, okay? So the word should be corrected because many things are not exactly medial and exactly lateral. It will be posterolaterally. So please write down laterally. We will have supinator, also common extensor origin, which is the muscles of forearm, common extensor origin, the muscles of forearm. To be more specific, these structures are posterolaterally. And we will also have extensor carpi radialis brevis muscle. Okay. Now let's draw a diagram. So it's important to draw a diagram for it to appreciate the relation. So I would like to draw a diagram showing the relation of elbow joint. So let's draw a diagram showing, the heading will be relations of elbow joint. Relations of elbow joint. So the relations of elbow joint, we have to again actually, so this will be a schematic diagram. So on anterior aspect, I will show you the brachialis muscle, which is the floor of cubital fossa, which lies on anterior aspect of elbow joint, medial nerve, brachial artery, and also the biceps brachii muscle tendon. Posteriorly, exact posteriorly, olecranon process is lying. So there will be the muscle attached to it. Triceps muscle and unconeus will be also on the posterior aspect. Medially, if I go more of the posterior aspect, actually there will be also, if I go more towards the posteromedial aspect, then we will also have the ulnar nerve, and we can see the common flexor origin. Posterolateral aspect, or laterally, we will have the common extensor origin and extensor carpi radialis brevis. So now we will again draw a schematic diagram. Obviously, the rounded structure, which I mean, is the capitulum. Okay. Medial lateral epicondyle, I have medial lateral epicondyles, I have. So these are bony structures, my dear. Okay. Okay. Now on this, I would also like to, I have also shown you and told you that medial and lateral epicondyle is extracapsular structure. Distal aspect of medial lateral epicondyle, we have got the attachment of fibrous capsule. So now I just want to draw an outline of fibrous capsule here, just to make you understand. I want you to draw the outline of fibrous capsule. Okay, this is just an outline. This green color is for the fibrous capsule attachments. Just an outline. Done. Okay. Now anteriorly, I would like to draw some bony structures. So we will have some bony structures anterior. On the anterior bony structures, we will have the brachialis muscle. Okay, so we will draw that. We will have the outline of this brachialis muscle. Then we will draw the tendon of biceps also. Okay. This brown color is for the brachialis muscle. So these structures are on the anterior relations of elbow joint. So this structure is the brachialis muscle, my dear students. Okay, which artery is this? This is the brachial artery. Which nerve is this? This is the median nerve. And which muscle is this? This is the brachialis muscle. So all these structures will be together. All these structures will be together in the anterior relation of elbow joint. Okay, drawn anterior relation. Now medial relation. So for medial relation, I will draw here common flexor origin. On lateral side, we will have the common extensor origin. So what are these? These are actually Okay. Okay, so we will have also we will have a muscle, and we will have a nerve that will be posteromedially. This is ulnar nerve, this is the muscle, this is the flexor carpi ulnaris. So medially we will have flexor carpi ulnaris. We will have common flexor origin. We will have common flexor origin. And we will have ulnar nerve. Ulnar nerve. And what are these structures? So these structures are these structures which you are seeing is in the medial relations. These structures are medial relations. In the elbow joint. Okay. Ulnar nerve to be more posteromedially. Okay. Now, this green color structure I just want to mention here itself. This is the cut edge of the fibrous capsule. This is cut edge of fibrous capsule. Yes, my dear students. Now, what structures are related on the posterior aspect exactly and the lateral aspect? So, here from that aspect, if I want to tell that here will be again drawn a muscle, extensor carpi radialis brevis and the common. So, this is the fibrous capsule. This is the extensor carpi radialis brevis. So the structure will be ECRB. This structure will be common extensor origin. And my dear, what are these two structures related to? These structures are lying in the lateral relation. Lateral relation. Now, what structures lying on the posterior aspect? So when I talk about the posterior aspect, we will have the anconeus and we will have the triceps. Actually, there is a nerve which is given in the as a branch of radial nerve in the spiral group, that is nerve to anconeus. So nerve to anconeus, anconeus and the triceps muscle. All these structure will be in the posterior relation. Okay. So on the posterior aspect, we will have the anconeus muscle. We will have nerve to anconeus and we will have the tendon of triceps. Okay, so we will have these three structures. So please write on, this is triceps tendon. This is triceps tendon. This is anconeus. And this is nerve to anconeus. So these three structures, if I talk about these three structures are called as, if I talk about these three structures are related in the posterior relation of, these three structures are in the posterior relation of elbow joint. Okay, so this is a schematic diagram which is representing the anterior, the posterior, the medial and the lateral relation. And exactly which structure is exactly medially. So I told you anteromedially is the common flexor origin and posteromedially is the ulnar nerve. And if I talk about the extensor carpi radialis brevis, this will be mainly posterolaterally. Okay. So now done with this, now let's know about the nerve supply and the blood supply of elbow joint. So basically, let's talk about the blood supply. Blood supply of elbow joint. So if I talk about the important blood supply of elbow joint, it is actually taken, the source of arterial supply to the elbow joint is the arterial anastomosis. So in the class of arm, I have told you about the arterial anastomosis around elbow joint. So basically it is via anastomosis around elbow joint, and the anastomosis which was taking around elbow joint is formed mainly from the branches of brachial, radial and ulnar artery. That is from the branches of brachial, radial and ulnar artery. Okay. Okay, dear. Okay. So yes. So yes, go through your paper and the most crux point you have to revise it. Okay. So, okay. Now let's talk about the nerve supply. Okay, so whichever portion is coming, Mudit, you can just revise it. Okay, Mudit, आपका पेपर है तो आप वो टॉपिक्स पढ़े जो आपको एग्जाम में आएगा. Not to worry, all the important anatomical aspects you have to revise. So you just revise your portion which is going to be asked in examination. Okay, so if I talk about the nerve supply, it is via radial nerve. To be more specific, a branch of radial nerve, that is branch to anconeus muscle. Not only this, it also receives innervation from the ulnar, median and musculocutaneous nerve. So musculocutaneous nerve. So actually musculocutaneous nerve is via branch to brachialis, branch to the brachialis muscle. Actually musculocutaneous nerve supplies the BBC muscle of the anterior compartment, and branch to brachialis muscle and branch to anconeus is the source of the innervation of the elbow joint, along with the contribution of ulnar and median nerve. Done? Okay. Other than that, what is the stability of elbow joint? So what are the factors which is important for the stability? Stability of elbow joint. So yes, if I am talking about stability of elbow joint, the structures which increases the stability of elbow joint is the pulley-shaped trochlea, which is fitting into the trochlear notch of ulna. So trochlea fitting in the trochlear notch of ulna. So this is trochlea of the humerus, which fits into the pulley-shaped trochlea, fits into the trochlear notch of ulna. So this is a very important articulation which is increasing the stability of elbow joint. And we have got strong ulnar, we have got a strong ulnar collateral ligament which is having 3 bands, and also a strong radial. So strong ulnar and radial collateral ligaments. So these are the structures which is increasing the stability of the elbow joint. Done? So we have done with this. Now we will talk about the applied anatomy. Okay, before that, I also want you to know about the movements. So what movements takes place? So let's talk about the movements. So let me tell you also about the movements, which is, so let's talk about the movements which is possible. So write down movements. Let's talk about movements of elbow joint. So basically elbow joint is a hinge variety of synovial joint. So only 2 movements are possible around the elbow joint: flexion, extension, flexion, extension. So let's see which muscles are the primary flexors, which muscles causing flexion of elbow joint, and which muscles are causing extension of elbow joint. Okay. So flexion, the muscle causing flexion of elbow joints are brachialis muscle, the biceps brachii muscle, and also the brachioradialis muscle. Okay. Extension of the elbow is done by triceps and coneus muscle. Two muscles are causing extension of elbow joint, that is triceps and anconeus, and the muscle causing flexion of elbow joint is brachialis, biceps brachii, and brachioradialis. Okay. Now let's talk about the clinical anatomy. So firstly, I would like to talk about the carrying angle. So let's talk about the carrying angle of elbow joint. So carrying angle actually, when the elbow is extended, what you can see that the arm and forearm is not lying in a straight line. Rather, the forearm is extended laterally, which you can see. This is the axis of forearm. As you can see, this is the axis of forearm. Okay, this is the axis of forearm and this is the axis of humerus. So what you can see, the forearm is deviated. In this diagram, you can see forearm is deviated laterally. It is more deviated laterally. Okay, so the deviation of the angle of deviation of the long axis of forearm from the long axis of the humerus bone is called as carrying angle. So what is carrying angle? When the elbow joint is extended, the angle of deviation of long axis of forearm from the long axis of humerus is termed as the carrying angle. So carrying angle is, you can just write here, carrying angle. This angle is, this is an angle of deviation of long axis of forearm from long axis of arm, which is termed as the angle of deviation of long axis of forearm from long axis of arm is termed as carrying angle. This is the simple definition. And if you actually want to be more, so basically we can see also this is exactly the carrying angle, where you can see the long axis of forearm deviation which takes place from the long axis of humerus bone. And other important point is, this is seen only visible when we extend the forearm. When we are extending the forearm, we are extending the elbow, then the forearm is seen to be deviated laterally. Okay, then you can see the forearm is deviated laterally. But when actually we are in, the angle will disappear when the full flexion of forearm is done. So this is extension, this is flexion. So then this carrying angle will disappear. The carrying angle normal variation is 5 degree to 15 degree, and it is more pronounced or more evident in females. So you can see here. Here you can see the carrying angle has got an angulation of 10 to 15 degrees in case of females, and as an overall range is 5 to 15 degrees. So the carrying angle will disappear when the elbow is in full flexed position, and the carrying angle normal varies. The carrying angle varies from 5 degree to 15 degree. Okay, and it is more pronounced in females. The wider, so actually wider carrying angle in female avoid rubbing of the forearm when the females walk, because they generally have got a wider pelvis. Okay, so basically, for example, just to show you, bucket is filled with water and the female is carrying the bucket of water. So the forearm is an extended position, and here you can see the elbow is not rubbing with the body because of the presence of carrying angle. Okay, now let's talk about more of elbow clinical anatomy. So one of this case is elbow effusion. So effusion of elbow joint. So basically, distension of elbow due to effusion which occurs within the cavity is occurring more posteriorly, and the reason why it is occurring posteriorly is the fibrous capsule is thin posteriorly. So this is the anterior fat is raised, posterior fat is visible, anterior pad of fat is parallel to the distal humerus, posterior fat is not visible. So basically this is a normal case, but in the abnormal one, you can see the posterior fat pad is visible. That is a case of elbow joint effusion. So elbow joint effusion, the distension the distension of elbow joint due to effusion within the cavity occurs posteriorly. And the reason why it occurs posteriorly is because the fibrous capsule is thin posterior. The reason is that we have got the fibrous capsule thin on the posterior aspect. So the reason is fibrous capsule is, FC for fibrous capsule is thin posteriorly. Now, what is the treatment? The treatment is, if I talk about the treatment is the joint aspiration, and the joint elbow joint can be aspirated by inserting a needle on the posterolateral side above the head of radius. So basically the elbow should be in right angle, and the elbow, when it is in the right angle, the effusion fluid can be syringed out, and this for that aspiration has to be done. So a needle is inserted on the posterolateral side above the head of radius. So that is very important. Note point. Please write on the note point. Elbow joint is aspirated from posterolateral side. Posterolateral side. The aspiration should always be done from the posterolateral side. Why? Because it is actually exactly easy to perform and not much risk of the structure being injured. So it should be done posterolateral side above the head of radius, and the position which will be there, the elbow should be at right angle. Okay. Now let's talk about more of the condition, elbow dislocation. So when I'm talking about the condition of elbow dislocation, as you can see, the person has, so basically in elbow dislocation also the dislocation which is more common. So if I'm talking about the dislocations which is more common, so this is, you can see here, the patient is falling just on the hyperextended. So you can see the patient here is falling, the person is falling, and the elbow is more prominent to get displaced posteriorly. So the posterior dislocations are more common. Posterior dislocation of elbow is more common. Okay. So this is actually happening when the person is, what you can see in this image, the person has fall on outstretched hand. So you can see the person has fall on outstretched hand, and then the elbow is dislocated on the posterior aspect. So basically we know that if we are talking about three important relation, so that is the olecranon process, medial and lateral epicondyle. So olecranon process of ulna and the medial and lateral epicondyle of humerus, if we connect these three bony points, then there is a triangle formed. Okay, there is a triangular relation formed. This triangular relation will be disrupted when the posterior dislocation of elbow takes place, when a person falls on outstretched hand. Next condition. Now let's talk about the other condition, nursemaid elbow, or you can say pulled elbow subluxation of head of radius. So basically it's generally seen in the 1 to 3 or 4 years old child. Okay, so many person has got a bad habit of, as you can see, just sometimes to save, like caregivers and are there, so they want to save the child from falling back, and they quickly grabs the babies and childs from the forearm, and suddenly the forearm is pulled in pronation. This will lead to the condition of pulled elbow, which is called as subluxation of head of radius. So basically the head of radius will come out from the annular ligament. As you can see, annular ligament se head of radius come out ho jata hai, and then if an attempt is done to supinate the babies or the child forearm, that will be a very painful condition. Okay, so that is a very painful condition. So please write on. In pulled elbow, or in the case of subluxation of the head of radius, the head of radius comes out of annular ligament, and elbow is slightly flexed and pronated. Okay, So if the person wants to supinate the elbow, it will be a very painful condition. What will happen? It will become a very painful condition. It will become a painful condition. So the reduction is done, and the reduction can be achieved by. So how the reduction of this pulled elbow is done? So pulled elbow reduction is done by supinating. So we have to supinate by supinating and extending the elbow, and at the same time, like simultaneously direct pressure is given posteriorly to the head of radius. So supination and extension of elbow will be done by the doctor, and at the simultaneously a pressure will be applied posteriorly, on the head of radius. Okay, a pressure is applied posteriorly on the head of radius. So this is how the reduction of this pulled elbow can be done. Okay, now coming to the next, tennis elbow, that is also called as lateral epicondylitis. So it is a condition which is characterized by pain, which is happening onto the lateral epicondyle of humerus, which is basically during the abrupt pronation. It occurs in the in many of the athletes, and actually it's a clinical condition where there is a pain on the lateral epicondyle of humerus. So actually the reason, which is because the reason of this painful condition is the inflammation which is occurring at the lateral epicondyle area, is the sprain of lateral collateral ligament, tear of the fibers of extensor carpi radialis brevis muscle. So basically this is the image where you can see the tennis elbow lateral epicondylitis, and in this condition, if you will see, the lateral epicondyle area of the humerus is involved. This is the area of inflammation. This will involve the common extensor tendon muscle origin. So basically, if I talk about the reason, so for a reason will be sprain on lateral epicondyle of humerus. So I'm just enumerating. This is the one of the reason. The other reasons will be tear in fibers of extensor carpi radialis brevis. We have also seen the relation of extensor carpi radialis brevis posterolateral aspect. So what is the full form of ECRB? Extensor carpi radialis brevis. So actually, and the third is involvement of a bursa. Bursae beneath ECRB. So a bursa involved beneath ECRB, that can be involved, or a strain in common extensor. The fourth reason will be strain in the common extensor origin. Fourth reason will be strain, extensor, common origin strain. These are the reasons of the tennis elbow condition. Now coming to the next condition, this will be the condition of golfer's elbow. So when I talk about the condition of golfer's elbow, what you can see, the effect is on the medial epicondyle, the common flexor origin, golfer's elbow, the common flexor origin. So here pain and tenderness will be on the medial epicondyle. So the patient will have pain and tenderness basically on the region over medial epicondyle of the humerus bone. So the reason of golfer's elbow is straining on the common flexor origin. It occurs due to strain or tear of common flexor origin, which takes place from the medial epicondyle. Also the so actually repeatedly, if we use the, so basically other reason is the repetitive use of superficial flexor forearm muscle. So basically we know that superficial flexor forearm muscles, if I'm talking about, they have got a common origin from the medial epicondyle of humerus. So that is the reason the golfer's elbow medial epicondylitis will be seen. Now other than that, let's talk about another condition that is called as student's elbow or miner's elbow. So you can see there, this condition is showing you the olecranon bursitis. So what is the other name here? There is sub, we know that at this location, I have already shown a diagram and I have shown you there are two bursas in relation to olecranon. One is like olecranon tendinitis, means this is, one is subcutaneous olecranon bursa, which can be involved in case of students, and this are called minors or students elbow. So here there is involvement. This is called as the student's elbow condition. Okay, because they study for long period of time and they put pressure on the olecranon process of the ulnar bone, and this is the corresponding areas which is involved. Now it is characterized by rounded, as you can see in this condition also, rounded fluctuating swelling is over the olecranon process. It occurs due to inflammation of, so this condition occurs due to inflammation of olecranon bursa. Which olecranon bursa? In relation to olecranon bursa, we have got two. One is subcutaneous and one is subtendinous, beneath the tendon. So this is subcutaneous. Posterior aspect of olecranon process has got friction, constant frictions in the students, leading to student's elbow. Now coming to the next. So I would, before proceeding to the next, that is proximo-radio-ulnar joint, I would also like everybody to understand nerve entrapments or compressions which can happen around the elbow. So basically many of the nerves are there related. So I would like to actually, I would like to tell that there is ulnar nerve related, posterior interosseous nerve, there is median nerve which is located in the surrounding area of elbow joint. So they can be compressed. So let's talk about few important examples which can be affected in the case of entrapment, nerve entrapment around the elbow. So one of the entrapment is median nerve entrapment. So if I talk about median nerve entrapment, it will happen when it passes between the two heads of. So one of the condition is when median nerve passes between two heads of pronator teres muscle. Okay, and the other reason is when it passes between the so actually the other reason is when it passes between the origin of two orisino-flexor digitorum superficialis muscle. Flexor digitorum superficialis muscle is the superficial group of flexor forearm muscle, but it is in intermediate location. So we know that it can pass deep to the fibrous arc of humero-ulnar and radial head of FDS. So that is the reason where the median nerve entrapment can happen. So median nerve entrapment can happen beneath the fibrous arc, between humero-ulnar and radial head of flexor digitorum superficialis. Humero-ulnar and radial head of FDS muscle. What is FDS muscle? Flexor digitorum superficialis muscle. This is commonly seen. Now coming to more of nerve entrapments around the elbow joint. So the second nerve entrapment will be the ulnar nerve entrapment. So if I talk about ulnar nerve entrapment, it can happen behind the medial epicondyle. So exactly behind the medial epicondyle, when it lies in between the medial epicondyle posterior aspect and olecranon process, that is the commonest site of ulnar nerve entrapment. And when it passes through the cubital tunnel, when the ulnar nerve passes through a cubital tunnel which is formed by a tendinous arc between the ulnar head of flexor carpi ulnaris and humeral. So a tendinous arc. Cubital tunnel is a tendinous arc formed by joining humeral and ulnar head of FCU muscle. What is FCU? Flexor carpi ulnaris muscle. Got it? Now the third entrapment, which will be the entrapment of posterior interosseous nerve. What is, my dear, posterior interosseous nerve? It's the deep branch of radial nerve. So when I am talking with the posterior interosseous nerve, the deep branch of the radial nerve, which is passing in the supinator muscle. So it passes deep to, when it passes deep to arcade of Frocy. Okay. Arcade of Frocy. Actually, arcade of Frocy is a musculoaponeurotic structure, and actually it is connecting the supinator muscle proximal edge, and it is passing through the substance of supinator muscle. So posterior interosseous nerve passes in the substance of supinator muscle. So it is actually, this arcade of Frocy is a musculoaponeurotic structure at the proximal edge of supinator muscle. So it is located, it is a musculoaponeurotic structure at the proximal edge of supinator muscle, and after that also it can be compressed in the substance of supinator muscle, edge of supinator muscle. And if I talk about posterior interosseous nerve, it can be also compressed inside the supinator muscle substance. Done. So as I told you, radio-ulnar joint, also let me explain briefly about radio-ulnar joint. Actually, if I talk about radio-ulnar joint, we will have superior, inferior, and the intermediate radio-ulnar joint. So what is important for you? So when I'm talking about the superior, inferior radio-ulnar joint, which is shown in this diagram, this is the superior, this is the inferior, which is also shown here. Articular disc of the articular disc is also shown here. So basically, there are this both superior and inferior radio-ulnar joints are pivot type of synovial joint, and they are actually these joints has been shown, and they are at the upper and lower end of the forearm bones. Now basically, if you will see the middle part of the radius and ulnar bone, they are connected by interosseous membrane. So the middle radio-ulnar joint is a type of fibrous joint that is called as syndesmosis. Okay. So basically, if I talk about the proximal radio-ulnar joint, it's an articulation which is seen between the head of radius and the cartilaginous ring, which is we have got a fibro-osseous ring which is formed by the radial notch and the annular ligament. So this is how the superior radio-ulnar joint is formed. When I am talking about inferior one, it is formed between the head of ulna and the ulnar notch of the radius bone. Okay, and the middle radio-ulnar joint is formed by the interosseous membrane, which is connecting the middle part of the radius and ulnar bone, and middle radio-ulnar joint is the type of syndesmosis. So that is very, very important for you to know. Then we will also, so I just want you to say briefly about the superior inferior radio-ulnar joint. I have shown you in the image. Superior radio-ulnar joint, inferior, both are pivot type of synovial joint. Okay. Articulating surface is important. Articulating surface. So the articulating surface is formed by the circumference of radial head and by the radial notch of ulna, articulating with the radial notch of ulna and annular ligament. Okay. Inferior or distal radio-ulnar joint. Inferior distal radio-ulnar joint is again synovial pivot joint. Pivot joint of synovial joint, synovial variety, and articulating surfaces. It is formed by the convex head of ulna lying lower down and that of the concave ulnar notch of radius bone. Concave ulnar notch of radius bone. So this is how the distal radio-ulnar joint is formed. What about the middle radio-ulnar joint? So, and we have done with this. I also want you to know about middle radio-ulnar joint. So if I talk about middle radio-ulnar joint, it is having the articulation via interosseous membrane, which is having a type of synarthrosis, no movement joint, and it is a fibrous joint of which variety? Syndesmosis. These are all which will be asked in your viva practical examination. So done with this. So let's know a few more points. So I just want that you should be knowing about, so exactly if I talk about the important points. So basically, we have seen the articulating surfaces and we are knowing about the proximal and the distal radial ulnar joint. So basically, if you compare this superior inferior radial ulnar joint, so on one side you can write superior radio-ulnar joint, inferior radio-ulnar joint, and you can compare both the joints. You can compare it. Okay, you can compare both the joints now. Is it okay? Yes. So we can just compare both the joints. So let's write the features. So the first feature is type, and I know both the joint is of similar type. What is that? Pivot type of synovial joint. So both are of similar type. Articulating surface we have discussed also. So articulating surface. Okay, articulating surface we have discussed it also. So articulating surface in case of superior radio-ulnar joint is the circumference of head of radius, is circumference of radial head, and fibro-osseous ring made by annular ligament, and radial notch of ulna, Here the articulation is head of ulna and ulnar notch of radius bone, head of ulna and ulnar notch of radius bone. Actually, this is overlapping things. These are similar for both the sides. What are difference is the communication. So if I talk about the joint cavity, the third important point is joint cavity. So if I talk about the joint cavity, the superior or the proximal radio-ulnar joint communicates with the elbow joint cavity. So this joint cavity, it communicates with elbow joint cavity. If I talk about the distal, if I talk about the inferior distal radio-ulnar joint, this does not communicate with wrist joint. It does not communicate with wrist joint cavity. This is a basic difference which is lying between. This is actually a basic difference which is lying between the superior inferior radio-ulnar joint. So actually, if I talk about stabilizing factor, the prime stabilizing factor of superior radio-ulnar joint. So the prime stabilizing factor. So the fourth point is very important, prime stabilizing factor. So prime stabilizing factor in case of superior radio-ulnar joint is annular ligament, and in case of the inferior radio-ulnar joint is the articular disc. Got it? Is the articular disc. Now the function of movement is similar. Again, the movement is not very different. Both are having same movement. So movement is both is similar, that is supination and pronation. Okay, so done with this. Now let's move further. So actually, I would also like to tell you briefly about the supination and pronation movement. So basically, supination means this is supination and this is pronation. This is supination and this is pronation. This is a rotational movement, you can see. Okay, supination and pronation is very important performing skill movement, and this is actually basically, if you will see, when the elbow is semi-flexed and in mid prone position. So you can see when the elbow is semi flexed and mid prone position, this is pronation, this is supination, this is pronation, this is supination. Okay, so basically, in other words, just to remember, we can say beggars supinate and the kings pronate. How to remember? Beggars supinate, they asks you something, beggars will supinate and kings will pronate, give you ashirwad, okay, give you blessings. Okay, so it's a very important rotationally movement. It is a rotational movement which is seen in the forearm, and it is actually occurs in the superior inferior radio-ulnar joint along a vertical axis. So that is very important. So one of the important point about supination. So write down supination and pronation movement. Supination and pronation movement of forearm occurs at superior and inferior radio-ulnar joint. So this movement which occurs at the superior inferior radio-ulnar joint will be occurring around a vertical axis. So this movement is occurring around a vertical axis. Can you see here? This is the axis of movement. This is the axis of movement, and this axis is a vertical axis of movement which is actually connecting. So basically, if I talk about this is exactly the axis of movement, and exactly I would like to show you this axis. So to be more specific, supination, pronation, this vertical axis is more in oblique direction. So let me show one more diagram. So exactly this is the axis of movement of supination and pronation, as you can see in this diagram. Okay, so exactly supination and pronations are rotatory movements of the forearm. So we know that they are rotatory movements of forearm. They are rotatory movements of forearm. The axis is the oblique axis, and it is passing from the center of head of radius. So you can see this is the axis which is passing from the center of head of radius bone. Okay, and this axis is passing from the center of head of radius above to the stelloid process of ulna below. And here you can see this is the stelloid process of ulna below. So this is the stelloid process of U for the ulna. So exactly this is the line. If you want, I can just pronounce it more. Okay, so this is exactly the axis, the rotational axis around which the supination and pronation movement of the forearm takes place. This axis will pass from the center of head of radius to the stelloid process of ulna. Okay, the axis of movement of radius and ulna joints pronation is not stationary. It is actually moving forward and medially. I talk about this axis, it is moving more forward and medially during supination, and this axis moves backward and laterally during the pronation movement. So that is a very important note point. The axis which I have shown you, that is the axis of movement of supination and pronation movement of forearm, which is passing through the head of center of radius to the stelloid process of ulna. It's not stationary. It is actually slightly movable. The axis moves. The axis of movement moves. The axis of movement moves forward, and it moves forward and medially. Forward and medially. In which movement? In supination movement. In supination. In supination movement. And the axis moves backwards and laterally. Backwards and laterally. In which movement? In pronation movement. In pronation movement. So this is important for you to understand. This is an important point which you should pay attention. Now, exactly, the other important point is in supination. When I'm talking about the supination, can you see it? This is showing you the supination and this image is showing you the pronation. So when I'm talking about the supination, movement, the radius and ulna lies parallel to each other. Can you see here? Both radius and ulna. So in this case, radius and ulna bone in supination are parallel to each other. They are parallel to each other. The radius and ulna bones are parallel to each other. Okay, slightly we can enlarge this. Yes. Okay, parallel to each other. But if we are talking about in pronation, there is a rotation of lower end of radius. Can you see? When the pronation is taking place, the radius lower end is rotating. Okay, so in this case, when the pronation process is taking place, the lower end of radius along with the articular disc of head of radius is actually it is lower. So basically what happens in the pronation, there is rotation. This is supination, this is pronation. So there is rotation of the lower end of the radius along with the articular disc of the head of ulna. So in pronation, there is lower end of R for radius and AD for articular disc of ulna also moves. They also moves along with the radius, and as a result, lower end of radius. As a result, can you see here? Here you can see this lower end of radius. When you will see the lower end of radius, you can see the lower end of radius is moving forward. So as a result, the lower end of radius crosses in front of the lower end of ulna. So here you can see this is the radius bone, and as a result of this rotational movement which is happening along the pronation, in which lower end of radius and articular disc of ulna is also moving, the radius comes to life. The radius will rotate and this will cross the front of lower end of ulna. So simultaneously what happens, the head of radius also rotates. Simultaneously there will be also rotation of head of radius within the fibrous osseous ring in the annular ligament. So this radius superior part superiorly also rotates and inferiorly also rotates. So this is how the supination and pronation occurs. So exactly morphologically, if in the simple language you want to understand supination and pronation, so we can say it is like picking of food. Picking of food is involving pronation process, and putting the food in the mouth is involving supination process of forearm. So that is important for you to understand. So what is important for the viva is to know which type of joint is superior inferior radio-ulnar joint, which joint is communicating with the elbow joint, proximal radio-ulnar joint, wrist joint, and the inferior radio-ulnar joint is not communicating. They are separated by the articular disc. Other than that, you have to know what is the vertical axis which is passing for the rotational supination and pronation movement, which is passing through the center of head of radius to the styloid process of ulna. This axis is not stationary, and when we are talking about supination, both the radius and ulna bone is approximately parallel to each other. But when pronation process happens, the lower end of radius rotates along with the articular disc of ulna, and in the simultaneously process, the superior part of the head of radius also rotates, as you can see here, and the radius comes to lie forward on the ulna bone. Other than that, it is also important for you to know that which muscle causes supination and which muscle causes pronation. So I just want you to write muscles causing supination. Supination and pronation. So it is important for us to know which muscle causes supination and which muscle causes pronation. So let's write it. Supination is caused primarily by supinator muscle, also by the biceps brachii muscle. These are all asked in the MCQ. Biceps brachii supinates the forearm when elbow is flexed. Biceps brachii supinates the forearm when the elbow is flexed. Okay. Brachioradialis radialis muscle supinate the pronated forearm from mid-prone position. Pronated forearm. Brachioradialis supinate the pronated forearm to mid-prone position. To mid-prone position. Brachioradialis supinates the pronated forearm to mid-prone position. So this is the brachioradialis supinates the so basically this is the mid-prone position. So brachioradialis is supinates the pronated forearm to the mid-prone position. Okay, so this is, so basically brachioradialis is active in the mid-prone position. So this is pronated position and brachioradialis will supinate it to mid-prone position. To mid-prone position. This is the action. Now coming to pronation. Pronation is done by two muscles, pronator teres, the superficial forearm muscle, flexor forearm muscle, and pronator quadratus, the deep flexor forearm muscles group, and the brachioradialis. Now here also brachioradialis is active. So brachioradialis pronate the supinated forearm to mid-prone position. Okay, this is the exactly the muscle active. So brachioradialis now pronate the supinated forearm to mid-prone position. So this is supinated and this will pronate it to the mid-prone position. So basically brachioradialis is doing the movement to mid-prone position, supination and pronation. Other than that, I also want you to note down that supination is a more powerful movement than pronation, because supination is this. Supination is an anti-gravity. Supination is an anti-gravity movement. So please make a note. Supination is more powerful. It's a more powerful movement than pronation movement. So basically supination is being a more powerful movement than the pronation movement. This is important for you to. So basically if I talk about the movement, so it is performed by powerful muscles like biceps brachii muscles. So basically biceps brachii muscle is a powerful muscle. The pronation is less powerful by supination because it is performed by less powerful muscle like pronator quadratus and pronator teres. So supination is done by a powerful muscles like biceps brachii. Pronation is mainly done by pronator teres, pronator quadratus. They are less powerful muscle. And also supination is an anti-gravity movement. Okay, supination is used for tightening. So exactly this is supination and this is pronation. This is supination and this is pronation. So basically we have got supination, we have got pronation. So basically if I talk about supination movement is useful for tightening nuts. Supination process is useful for tightening the nuts, and for making the nuts loose we use the pronation process. Okay, so after this I just want everybody that you should we have completed the topic, that is elbow joint and superior or proximal radio-ulnar joint, and I just want that you should go through this session because this is very, very important session. Okay, many times the students tell me, okay ma'am, so let me just check that we will study only the most important topics, but what I want you to tell about this topic of elbow joint, the superior inferior radio-ulnar joints and all the joints which I have explained, why it is very, very important thing to be studied. Before ending, I just want you to have an idea of these all important things which I have completed, because this is repeatedly asked in examination and it is very, very important that you should understand the concept of supination, pronation axis. You should understand the concept of elbow joint. You should know about the ligaments, their attachment, which is the more powerful. We have got tri-band. We have got anterior, posterior and inferior band of the medial collateral ligament. What is the attachment of lateral collateral ligament? What is the attachment of fibrous capsule and medial epicondyle, lateral epicondyle of humerus are extracapsular structures, type of a joint, articulating areas, and various diagrams which I have made. I have made a diagram showing you also the relations of the elbow joint. So you should go through all this and be revise it. If any doubt is there, I am again coming for the next session tomorrow evening session class, so you can ask me right there itself the doubts. All the best and keep studying. We'll again meet in the next session. Thank you so much, my dear friends. Thank you so much.